Hello and welcome to another episode of your show Medical Talk at Dasman Diabetes Institute. I'm Dr. Mohammed Al-Mahtab. Like usual in this season in our medical program, we spotlight in the incredible work of the healthcare professionals at the Dasman Diabetes Institute. In today's episode, we will focus on the dedicated nursing department at the Dasman Diabetes Institute. Nurses here play a pivotal role in the comprehensive care of diabetes patients, offering personalized support and education to help manage this chronic condition. They are also at the forefront of groundbreaking research contributing to studies that aim to improve treatment and outcomes for those living with diabetes. Join us with our guest today, Ms. Annette Loudon, nursing manager, as we explore the vital contributions of these unsung heroes in fighting against diabetes. But not now, after this short break.
The Dasman Diabetes Institute, DDI, was established under the patronage of His Highness Sheikh Jabir Ahmed Al-Sabah, the late Emir of the State of Kuwait, and the Kuwait Foundation for the Advancement of Science, KFAS, to combat the prevalence of diabetes in Kuwait. DDI's mission to address the diabetes epidemic in Kuwait through focused diabetes research, integrated prevention, training, and education. DDI's vision: to be the leading diabetes institute in the Middle East and North Africa region and to be recognized internationally. DDI has established unique, innovative, technological, educational, and clinical platforms to discover mechanisms that cause diabetes. Ultimately, we want to aid in understanding the diabetes epidemic worldwide. We emphasize the importance of diabetes education through our lifestyle, nutrition, and the Clinical Skills Center, backed up with advancement in clinical research. This is a unique institute where we have the multidisciplinary team integrated within the clinic care research, starting from diabetes education, nutrition, physical activity, pharmacotherapy, podiatry, the imaging center, with all specialties including ophthalmology, nephrology, cardiology, cardiometabolic, and periodontology. The translational research goes from the bench to the bedside and back to the bench.
Welcome back. We're happy to have with us in the studio Ms. Annette Loudon, a nursing manager at the Dasman Diabetes Institute. Ms. Loudon, welcome to the program.
Thank you, and thank you for having me.
Thank you so much. And we have so much to talk about, but if you could tell us about the specific role of the registered nurses here at the Dasman Diabetes Institute.
Sure. So our nurses are committed to providing high quality professional nursing care for our patients here at Dasman. Nursing is such a diverse profession. We have many nurses working across various specialities who are highly trained and competent to do the job. Our nurses as well here, we provide the best service that we can for our team, and our nurses are the first clinicians that patients will see when they arrive at Dasman. So we want to make sure that our patients feel comfortable and in our patient care. Nursing profession, sometimes it gets the feel that it's, nurses only do vital signs, do a blood glucose, but our nurses here do so much more. So our nurses here do patient assessments for risk assessment, for falls assessments, basic fitness assessments for our patients. We also have nurses who are involved in education and training. So many of our nurses are also basic life support trainers. 50% of our nurses are also trained in advanced cardiovascular life skills, which is a highly skilled course.
Yeah.
And they then become part of our Dasman Code Blue team. So patients can be reassured if there was a medical emergency here that our nurses are providing an expert service.
Amazing. So speaking of the training and the courses they take, are there specific training and courses they need to take or undergo before actually being enrolled at DDI?
Yeah, so we ask that all of our nurses, anyone who's applying for a nursing job here at Dasman, must have completed a Bachelor of Science course in nursing studies. And we do look for nurses who have professional experience in working with patients with diabetes and/or research. However, what we really want from our nurses is the professionalism and the enthusiasm and energy so that we can tackle the epidemic of diabetes that's happening here. There's lots of opportunities for learning and development here at Dasman, and we very much support our nurses to take part in that.
So it's a continuous process,
Absolutely.
basically.
Absolutely.
So and I would assume since they are going through these major courses and training, are they accredited?
Yes. So our nurses study the American Diabetes Association guidelines yearly. Part of that we do in-service training monthly within our team, making sure that each topic within the ADA standards is covered as part of our monthly training. Any nurse who starts here at Dasman as well must go through a competency framework as well. And so that's to ensure that they have went through the competency for each speciality within our clinics, because we have a wide variety of clinics here at Dasman, and our nurses rotate amongst all of them. So there is a competency that they have to achieve to ensure that they are working at a level that we would expect our staff.
Amazing. So they get exposure to different specialities as well.
Yes, absolutely.
So speaking of accreditation, as you know, recently we are so proud with the Accreditation Canada, which happened here at DDI, and you played a major role in it as well with your team. Talk to me about it.
Absolutely. We are so proud here at Dasman of what we've achieved. So Accreditation Canada essentially provides healthcare services with a quality-focused assessment tool so that they can measure themselves against a set of standards that is provided by them, and so that we can ensure that we are providing an excellent standard of care. We were very fortunate here at Dasman that we have attained diamond level, and it's something that we incorporate into our everyday working life here. Just to give an example of some of the work that we do, so for example infection control, so our nurses are highly involved in that. They carry out environmental rounds, they do weekly audits with regards to hand hygiene, etc., measuring ourselves continually against these standards to ensure that we are maintaining that diamond level. So again, it's just we make it as part of our everyday work here in Dasman. We want to maintain that standard of care.
That's such a wonderful thing. We got more questions to go through, but we have to take a short break. We'll be right back. Stay with us. Welcome back. We're still talking in the studio to Mrs. Annette Loudon, a nursing manager at the Dasman Diabetes Institute. Ms. Loudon, before the break, we were talking about the accreditation and the courses the nurses they're going through. You also highlighted the fact that some of the nurses, or they have to, as part of the requirement, is that they go in a rotation. So do they actually get exposure to different departments like dental, ophthalmology, and other departments?
Yes, so our nurses here, as I'd mentioned, part of their competence when they start here at Dasman is they've got to rotate around our clinics to ensure that they are competent working within each department, and there's a framework that they've got to achieve as part of that. We do have more specialised, like within specialised clinics, for example, dental. So we have a core group of nurses, and they're the nurses who solely work in dental, but they will come out and work in other areas as well. So yes, they do rotate around. With the most specialised areas, we make sure our nurses, they do yearly competencies as well and yearly refreshers. So again, it's not just when they start and working in the clinics, because we want to make sure that our nurses are keeping themselves up to date with any changes that may be happening within clinical standards, and making sure that we're keeping ourselves refreshed and not just getting into old habits. So every year there's also a yearly competence that we make sure that nurses complete.
So the rotation process usually takes, what, a year?
So for new nurses, within the first 3 months, they have completed the majority of the cycle of going through. Because, due to staffing issues, etc., annual leave, etc. So nurses may stay in certain clinics for a longer time. It just depends on how the clinics are working themselves.
And after the rotation, are they allocated to a certain area?
No, so we actually split the team between 2 floors so that they can, and again, because it's good again to create relationships with the physicians that they work with on a weekly basis. But again, we need to allow for that movement between the team, again, just for staffing issues, for annual leave, for it to cover for any sickness.
Exactly, to be flexible, to cover.
Absolutely.
Just in case if there is a shortage or need, or at any other department, the nurse will be ready.
Absolutely.
I think that's very smart, and I think that's very wonderful. I want to ask you about the role of the nurses here at DDI in terms of the outreach activities, and particularly the mobile clinic we have here.
Yep. So the nurses are very much involved in that, as well as with other departments in Dasman, and they very much enjoy going out and meeting people, meeting the public. So these mobile clinics, the main aim of them is essentially to try and identify and to detect early any risk of diabetes, cardiovascular disease, because prevention is the key.
Absolutely.
There's many people, members of the public, who have diabetes, high blood pressure, etc. but they don't know they have it, and it's not until they maybe attend, you know, just a pop-up clinic,
Yeah.
an outreach, and it's where it's identified.
Hmm.
Unfortunately, for some patients, it's not until an event happens, such as a heart attack or a stroke. So this is what we're trying to prevent, is to try and target these people before that catastrophe happens.
Absolutely.
So during these mobile clinics, what happens, members of the public are able to attain a free health check where they can get their blood pressure, pulse, blood glucose check, height, weight, BMI. And it's where, you know, if any abnormality is noticed, that they can then give education, signpost, do any specific referrals that's required, or is it just a bit of education themselves if everything is okay, just that we're keeping ourselves healthy and how we can do that.
And most of that work is in the mobile clinic done by our nurses?
So our nursing staff are very much involved in the mobile outreach clinics that take part here in Kuwait. And it's part of a wider team. We have diabetic educators, and our PR team are very much the ones who are who organise these outreach events. And the main aim of these are to essentially detect any early signs or pick up if any signs of diabetes, cardiovascular disease, and they offer patients a free health check where they can come along, have their blood pressure, their pulse, their blood glucose checked, as well as their height, weight and BMI. And where they can receive, if there is any abnormalities picked up, they can receive education, signposting, any referrals that have to be done. And what we're trying to prevent is that significant catastrophic event. For many people, they don't realise that they have high blood pressure or diabetes until something happens, until they've had the heart attack, until they've had the stroke. And this is what we're trying to do. We're trying to prevent this from happening. Prevention is the key with the mobile clinics.
Absolutely. And all this service is basically provided mostly by our nurses?
Yes, yes. So they are on the bus, as well as with our diabetic educators and our excellent PR team who organise these. So yes, we also go out into schools. Our education and training team organise visits to schools, to other local businesses. They actively ask for DASMAN to come along. So yeah, so it's great to get out there into the community. The staff all enjoy being out there and meeting new people, meeting members of the public, and the public really enjoy it as well.
I'm sure. And I want to ask you about the World Diabetes Day event that's happened, and your role and your team's role in it as well.
Yeah, so similar to the outreach mobile clinics that we do. Last year we went to, in several years we've been to local malls, we've had events here at DASMAN. This year's theme is diabetes and wellbeing. And again, the nursing team will be very much involved in raising that profile, because again, as we're aware of the diabetes epidemic that's here in Kuwait, we're really just trying to share the word, spread the word, so that patients, we're identifying if there is any diabetes there, so that we can pick it up early and get it treated.
But they're very active, absolutely, and and it's wonderful to see that. I want to ask you about in my opinion, one of the most challenging tasks in any health organization is to maintain the high standards, basically, and the skills of the staff, regardless, whether they're physicians, whether they're nurses, and even in the admin staff.
Yep.
In terms of your department, how do we make sure that our nurses still maintaining the updated skills and the knowledge and the standards that we are aiming for? Absolutely.
And as I'd mentioned previously, for our nursing team, we ensure that they go through a yearly competence working within the clinics. It's something that we're continually ensuring that our nurses are keeping their skills and their profile up to date. Recently, what we've done here within our nursing team as well is we've created a continuing professional development framework, and this gives something for nurses so that they can reflect back as well. So they have to achieve so many educational hours per year. They also have to write 3 pieces of reflective practice. Now, whether that's on a piece of a course that they've attended, or has it been an interaction with a patient, or an interaction with a team building day that we've done. So we've got to do this reflective practice, and as well as they also have to achieve some feedback from their own team or from another member of staff. it's always good to, look within ourselves to say, how well am I doing? And it's nice to hear as well how, for someone to say how well you're doing.
Exactly.
So we're always trying to promote that kind of self-awareness, self-assessment. And we very much we've got a great team here at DASMAN, very much an open door policy. Any issues, please never feel afraid to raise any issues or come with a concern, or if you would like to implement a change, absolutely. We want to hear it, we want to be involved.
It sounds like I can almost hear two words: reflection and transparency.
Yeah.
So that's actually a very healthy environment to work with.
Yeah,
because
absolutely.
once they start to basically reflect on what they're doing, and to see actually what's happening and the impact of what they're doing, and also to be transparent with their superiors or the other colleagues, whether they like this particular issue or they don't understand a certain point, so we can all come together and discuss it and then better ourselves.
Yes,
basically.
absolutely.
Is there any collaboration between you and other healthcare professionals, whether it's here in DASMAN or other places in the Ministry of Health?
So absolutely. So here at DASMAN, for our nursing team, it's daily. As we've mentioned, the various clinics that our staff have to work in. So we have our radiology department, DIC. So our nurses there are skilled in working alongside the radiographers and radiologists, assisting patients with X-rays, CTs, MRIs, ensuring that patients are reassured and that patient safety is maintained. Some of the pieces of work as well that we've done along with podiatry. So our nurses here, we have a nurse-led foot screening clinic. So our nurses have all been trained by our skilled podiatrists that are here. They've also, as part of that training, they have to shadow the podiatrist. They are then supervised to ensure that they meet a level of competence, and they then have to pass a written exam as well. And then they are able to join our nurse-led foot screening clinic, and it frees up our podiatrist time for the more high risk, the more intense patients who are requiring, the expert podiatry level. Our low-risk patients are, according to ADA standards, all of our patients must attend for yearly foot screening. So our low-risk patients, they can come along, there's no waiting time or waiting list. They can come along to one of our clinics, be seen by one of our trained nurses. If there is an issue raised, podiatrists are there in clinic and they can come along or assist, or a referral can be made to the podiatry service if an expert opinion or a referral is required. So again, it's all about making that patient journey more effective. The waiting times are reduced, and again, just our patients are receiving the best care.
Is there like a long waiting list or like a long time?
So for particularly for podiatry, I think this is a problem in Kuwait as a whole, podiatry waiting times. We've got a great podiatry team here, and this is why we've introduced this nurse-led service, so that we can reduce that waiting time. So for the nurse-led service, there's no waiting time. There's, our patients are able to be seen fairly quickly.
Wonderful. We got more questions, but we have to take a short break. We'll be right back. Stay with us.
Thanks.
Welcome back. We're still talking in the studio to Miss Annette Loudon. Miss Annette, before the break, we were talking about we talked about our accreditation, we talked about the mobile clinic, but we talked about the role of your staff they're doing in outreach activities, and also the collaboration with other professional healthcare workers, basically. I want to shift the mood to one question is that the challenges the nurses face here at DDI. I don't think a lot of people not aware of most of the challenges. Can you explain to us in a nutshell, like what's the most challenged thing that they face on a daily basis here?
So our nurses are working in clinics that can be extremely busy, and particularly for diabetes, we deal with patients who can be agitated, distressed, because diabetes isn't just a physical condition. It affects, patients every day, part of their life, whether it's psychological, behavioural, societal. So they're dealing with all of these issues. And sometimes patients are coming to discuss with their physicians quite delicate matters, or they may be hearing news that might be quite life-changing for them. Yeah. So they can absolutely be distressed, angry, you know, emotional, and emotion plays a big part in it here. For us, for nursing, one of the core elements of nursing is caring, compassion and empathy, and we very much ensure that our nurses are expressing that for our patients. They are not only dealing with the kind of clinical side of things, but we want our patients to feel that they are comfortable and they're getting met with a smile, and you know that, as mentioned, the care and the empathy that we can give to our patients. Again, it's one of the core things. Our emotions can run high. When we do meet patients who are distressed or angry, we don't take it personally. We know it's not us personally. There's other things going on, and if we put ourselves in that patient's shoes, then perhaps we can see what's, you know, we would maybe feel the same. But again, it's just treating the patient with care, compassion and empathy, and it's just that reassurance that the patient might need just to de-escalate the situation.
And I don't know if you agree with me or not, but I think the patient-nurse relation is different than the patient-physician relation. I can say from my own experience that some of my patients, they will open up more with the nurses. They have a more empathetic relation with the nurse.
That's right.
And sometimes they can share more information.
Absolutely, you do. You find that. You find that the nurses, you know, the patients will speak to the nurses beforehand, but then when they go in to see them, you know, and don't ask any questions when they go in to see the physician. Or perhaps it's after they've left the physician, they're then, oh, I should have asked this, I should have asked that. And that's where the nurse can step in and, you know, help reassure or get those questions answered. So the nurse really acts as a patient advocate here. Yep,
absolutely. Well, we've got more questions. We have so many questions, but unfortunately, that's all the time we have here. I want to thank you personally and on a professional level for all the good work you guys doing here. And hopefully we'll be able to host you again in Medical Talk.
Yes, thank you. That would be amazing. It'd be great, you know, to speak about. Every year we celebrate International Nurses Day here, and it's something that we really want to make sure that the nursing as a profession is, you know, is being sold, it's being promoted. This year the focus for International Nurses Day was our nurses, our future, the economic growth, and it's really about how putting in a strategic plan to develop our nurses is only going to be for the better for healthcare in general. So we're really trying to implement that here and ensure that our nurses are seen. They are professionals. They do a great job. I'm so proud of them.
We are so proud of you, and I really, really appreciate your time with us. Thank you so much for having us. And dear viewers, we will still have more for you, but after the short break, stay with us. The Medical Fitness Center in Desmond Medical Institute promotes a healthy lifestyle through the delivery of scientifically designed fitness program via personal training, group studio classes, aqua classes, and open gym. This fitness center serves the role in helping patients with diabetes have a better quality of life and preventing more medical complications. Therefore, it is essential for patients with diabetes to enroll in some physical exercises. Before that, it is important to consult a fitness specialist to provide the best and most suitable exercising for them. Let's watch this report.
Hi, I'm Dennis of the SMAN Diabetes Institute from Medical Fitness Center. So today I would like to teach you about the strength training exercises using the TheraBand. So the purpose of these exercises and the importance of these exercises, it will give you an exercise that will promote the strength of your muscles doing these exercises inside your house. And the benefit of this one is it will keep your muscles strong, and it is very easy to do in your house, and it's cheaper because we don't have to go to any gym to subscribe for membership. As you see here, we have different kinds of TheraBands. So this have different color. So the lighter the color, the easier. Light resistance. The darker the color is more stronger or have a strong resistance. So we will use all these TheraBands doing the exercise, and also when you do it in your house, it will be your own preference or it's your own choice which color you want to do or you want to use. Now I will teach to you the exercises using this TheraBand. For me, I will choose this red TheraBand, which is light to moderate resistance, as you will see this. So the first exercise that you will do is for your back exercise. We call the exercise a seated row using the TheraBand. So we need to use a chair so that we'll able to use it. So you will place this on your feet, and then while sitting, you're gonna pull it slowly and smoothly. So we are targeting or we are exercising the back muscles. Okay, now the second exercise is for the chest, or in Arabic, it's like sadr. So we're gonna use a chair. So we're gonna put this at the back of the chair, and then we're gonna use both ends of it, and we'll try to push like this front, and then slowly go back again, then front again. All right? And all of these exercises, you will do it slowly and properly. Now the third one is the standing shoulder raise or lateral raise. So you will use again, this TheraBand. You will step on it, standing, and then you will raise your hands sideways. Okay, so we're gonna do it slowly and properly. The fourth one is the bicep curl. So same again, use the TheraBand as your preferred choice. So you're gonna do it in one line only, and step on it in the front, and you're gonna raise your hand one by one. You can do it single, one side, or you can do it both sides at the same time, like this way. If you want to make it harder, you can wrap it around on your hand and then do it like this, based on your preference of strength and resistance. Okay, so that's our 4 major exercises which we target the big muscles. I hope you enjoy this exercise using these TheraBands. Just keep doing it and keep healthy and fit. Thank you very much.
Well, that's it for our show today. Hope you enjoyed it. Until we see you again, please stay safe and stay healthy.